Hi, I'm Dr. Brian Humphreys. I'd like to talk today about tonsillectomy and what that means. Occasionally, tonsillectomy is also combined with adenoidectomy. The tonsils and adenoids are both part of the lymph system at the back of the throat. The lymph system is also part of the immune system. The function of the tonsils and the adenoids is extremely important during early life. The tonsils will breed certain germs, and the rest of the immune system cells will come by the bloodstream into the tonsils and train in how to fight the infections. A small child that's under the age of 2 usually will put everything that he finds in his or her mouth. Their little mouth is figuring out what's good to eat, and their little adenoids and tonsils are figuring out what's infection. A very active process before the age of 2. After the age of 2, the adenoids and the tonsils lose that function. However, frequently the germs continue to breed. Tonsillectomy used to be one of the most commonly performed surgeries in the United States. However, in the 1950s and 60s, it was overdone. I had my tonsils out in 1959 because my sister was sick. Mrs. Humphreys, all 3 children should get their tonsils out because they have them. This led to complications. Doctors who were not properly trained were doing the procedure under various kinds of anesthetics in their office, and complications occurred. Many people ask me how I know when a person needs their tonsils and adenoids out. Fortunately, when a doctor is board certified, the board, made by the Academy of Otolaryngology, Head and Neck Surgery, has science behind the recommendations. Any board-certified doctor will follow the recommendations of his academy. The American Board of Otolaryngology and Head and Neck Surgery agrees with the American Academy of Pediatrics on the reasons for tonsillectomy. We call these reasons and criteria indications. The most common indication for having one's tonsils removed is the same one that everyone knows about: frequent infections. The number 2 reason is when they are so enlarged that the teeth don't grow properly together, and there's abnormality of the facial growth in a child. Number 3, enlargement that actually causes obstruction of the airway. Snoring is not normal in children. Number 4 is a previous history of peritonsillar abscess formation in the throat. An abscess is a pus collection that has occurred during a severe episode of tonsillitis. Number 5 is a persistent foul taste in the breath due to chronic tonsillitis that does not respond to medical therapy. Number 6 is chronic or recurrent tonsillitis associated with a carrier state of beta streptococcus. This is the germ that causes rheumatic fever and may result in permanent heart valve and kidney damage. When someone has beta streptococcus, we remove the tonsils. Number 7 is when one tonsil is significantly larger than the other. Asymmetry of the tonsils is not normal. The body is symmetric. One hand glove size matches the other hand glove size. One eye color is the same as the other eye color. One shoe size is the same as the other, etc. When one tonsil is not the same as the other, particularly in older individuals, there is a suspicion of cancer, including lymphoma and squamous cell carcinoma. Number 8, recurrence of suppurative otitis with effusion. Usually we will only do adenoidectomy alone. Tonsillectomy would actually require one of the other indications that I've just mentioned. It's not for everyone, but when criteria from the American Academy are met, the surgery is then indicated and should be done. I will advise you if there are conditions like this in either yourself or your child. The risk of bleeding remains one of the largest risks of tonsillectomy and even adenoidectomy. On a nationwide basis, it was once cited that 10% of children who underwent tonsillectomy had a bleeding problem. The bleeding can be serious. Fortunately, we have looked for ways to reduce the risks of bleeding. These methods have included use of the laser and also include use of a newer device that uses radio frequency technology in order to seal blood vessels and nerves. The risk of bleeding is therefore reduced significantly. Now that has been studied and is under 2%. A different way of stating that is that tonsillectomy is now 98% safe. Yet there is still a small risk of bleeding. That's why I ask that everyone follow my instructions in the postoperative period. Should there be any degree of bleeding, except for a slight amount of spotting, which is normal, I would like to be called immediately. I will give you additional instructions. It is rare and uncommon, but when it occurs, I want to know.